What's up, everybody? Dr. Vong here. I'm here with my girl,
Erica
Romero. The lovely. Hey, you just had a birthday. Happy birthday!
Oh, thank you.
Happy
Thank you for all the
birthday
love.
to you. Happy birthday. A lot of people thought you were my daughter. Which is so wrong.
That's hilarious.
So today I want to talk about hospitalizations and why the numbers are actually higher than we think. And why we are in much worse situation than before. So while we're waiting for people to come on, I know I just kind of pop on at random times. I keep trying to have a regular time. Like I was supposed to go on at noon, but I was busy cooking your lunch, huh, babe?
Deliciousness.
It's gonna be delicious. So this will be a short, quick one because lunch is in 45 minutes. Mm-hmm. Yeah, I saw this Michael Simon recipe, the celebrity chef, the Iron Chef. Do you like Michael Simon?
I like him now. All the delicious meals he's been making.
Yeah, so we got some bean soup with like little riblets and stuff. It's gonna be delicious. So while we're waiting, where are you watching from? See, look at that. Nope, girlfriend, not wife. Nice try. Kelly is from Tennessee. Pat Clemens, longtime watcher. Margaret, you know Margaret. Mary Margaret.
Oh, Mary Margaret. Hey, Mary
Yeah,
Margaret.
how's it going? Brabco, what's up? Coffee hour. All right. Oh, look at that. I told you, baby. I'm world famous. I keep telling you. Where are all my world famous people? Come on, where's my international people? Somebody says, Michelle. You know Michelle.
Yes, love Michelle.
She follows you. Yeah. We're actually going to test Erica today with one of these COVID rapid tests because it's been 3 weeks or how long has it been? It's been a while.
It's been about 3 weeks.
Yeah, I do myself, and then I'll test myself too. Amy Cake Bread. I always laugh at her name. Sorry, Amy.
Hey, that was cool. Cake bread.
I know, but I'm a bariatric surgeon. She's followed me a long time.
Aww.
Oh, and then so I make fun of her name. But we know this girl.
Kathy.
What's up, Kathy?
Kathy.
Thank you for hitting share, everybody. Appreciate that. Kay Gordon. Phoenix, you're on fire, man. We're going to talk about hospitalizations. Yvette Brown. All right. Normally I get like 1,200 viewers, so we'll see if this face brings on more viewers or fewer viewers. What do you think? More viewers for sure. We're going to test her today. Orlando, Tracy, be careful. Florida is going to catch on fire. Michael, Chicago has been on fire for a long time. Sandy, what's up, girl? We're going live with Sandy tonight to do some cooking.
Delicious.
What are we making tonight, Sandy? New York City is about to go on fire. Canada, nope. Georgia's still cool. Shelley, Illinois. I was in Southern Illinois for a while. That's cool. California's in the house. Stay safe. Excellent. So we're going to talk about why the hospitalization rate is actually higher than we think. We're going to also test Erica real quick. And let's just go ahead and do it now.
Awesome.
You're busy. So you don't want to be hanging on here. Oh, hold on. Don't be jumping the gun. Dude.
The Rambler.
I am the Rambler. Hold on. So we're going to test her, and then we'll test me. I tested myself last week. I test myself every 7 to 10 days, 10 to 14 days. But so if you're interested in these COVID rapid tests, you can message me on Facebook.com/Dr. Vong. Just send me a message. It's really me, isn't it, honey?
It's really you.
It's really me responding. And it's really Erica and her mom putting these kits together. It's, if you can see behind me, we're actually in the game, formerly known as the game room. It is now
messy warehouse.
It's now headquarters for all of our COVID rapid tests right over there. And all those, see these boxes behind me? Oops, that way. Yeah, those are all boxes that need to be shipped out. So this is what we're talking about. We're going to test Erica real quick. I put these kits together. This is a FDA emergency use authorized EUA COVID rapid test. It's like a pregnancy test. But baby, did you pee on it?
Don't pee on it.
Don't pee on my fucking test. Don't pee on my test. I swallowed my own spit wrong.
Oh, hell.
Hey, look, France is in the house. Look at that. Or Spain. Mexico. Deborah, that's Mexico. I can't see. Can't see nothing. All right. Let's go back to the comments here. Let me see. Hold on. I'll get this off. New Jersey's in the house. Okay. So we're going to test Erica really quickly. And oh my gosh, let's make it a full house. You guys want a full house? All right, bring her in.
She's going to bust in to say hello.
Hello.
Say hi. Say hi to the viewers.
This is Mason. Say hi, Mason.
Hi.
How old are you, Mason?
4.
You're 4 years old. What's inside fingernails?
Keratin.
Keratin. That's right. What else do you want to tell us that's special?
So you could see a nose to smell something.
Yeah.
And then ears to hear.
That's right. Nose to smell, ears to hear.
And the eyes to see.
Yeah. What does a pangolin have in its scales?
Keratin.
That's right. A pangolin has keratin in its scales. Did y'all know that?
And then
Why are flamingos pink?
Oh yeah. This is a good one. Why are flamingos pink, Mason?
because they eat a lot of shrimp.
That's right. They eat a lot of shrimp. I bet you didn't know that. I bet you didn't know that flamingos are pink.
And octopuses have a beak too.
A beak?
Octopus have a beak to eat a clam.
That's very right.
That's right.
Crack the shell, huh? Good job, girls. Say bye to the viewers.
Bye.
Bye. See you
Later, alligator. Wildcrats, man. It's awesome. Okay, so I put together these COVID rapid tests. I had this card made for you.
Mm-hmm.
So if you order from me, you can't order these anywhere else, right?
No.
I'm the only crazy person who puts these together. If you find something like this on a website randomly doing a Google search, I promise you, you are not getting these. You're going to get a box. Let me grab a box. Oh, keep talking, Erica.
So it'll be a large box and everything will be separate. Everything comes separate. Dr. B gets the buffer. We put buffers in little vials. We send them over to you with the test.
Yeah.
The test has the buffer, finger prick, test, pair of gloves, Band-Aid, and the instructions.
If you order online, you'll get a box of like 25 or 20, which depends on which brand you get. Mm-hmm. But it won't have everything you need. So if you order from me, you'll get one of these. We're going to test Erica real quick.
The whole shebang.
The whole shebang. So let's open it up.
Yeah, open it up.
We'll open it up.
Super easy to take, guys. So this test is super easy to take. Comes with this nice little set of instructions here. Instructions tell you, sideways. The instructions tell you exactly what to do, how long it takes.
I had these made. You can't get these anywhere else.
Yeah. So what I do is this here is the test itself. And what I do is I get everything ready. So when I poke my finger, it's just quick and easy, get it done. So I open up the test.
This is an antibody test. So it gives you 10-minute results.
So we got the test here. The test has a little pipette. Get my Band-Aid and my alcohol swab. I'm going to pull them closer to me so you all can see.
I'll give you a pair of gloves in case you're scared of blood.
Yeah. Honestly, it's just a drop of blood. I never use the gloves, but for safety, handling blood can be dangerous. So we do make sure that those are in there. I got my Band-Aid ready here.
Here's your alcohol wipe.
Alcohol wipe, clean that finger.
Rapid test, 10-minute results.
I always do it on my left hand because it's my less dominant hand.
Which finger?
And I use my pointer.
Oh, I use my pointer too.
Of course, Dr. B. Alrighty, so you get the little poke.
Oh, wait, hold on. Do you have to take off the cap?
Yes. So there is a cap on this. You're going to pull the little white cap. Pretty self-explanatory there. And what you're going to do is you are going to pick the side of your finger. Honestly, guys, it did not hurt at all. And here I do have, you can see the little blood. If for some reason your finger is not producing a large enough drop, just hold your arm down for a moment. And then what you can do is squeeze your finger and you see the drop literally just almost tripled in size by me doing that. Nice. So I got that drop.
Ooh, that's a big drop. You're a good bleeder.
Big drop, good bleeder.
Here's the test. Oh, you can't see it. There it is.
The test. So you'll see it has these two areas right here, two little wells. And the well, there is well S and well B. S is going to be for the sample of blood. B is going to be for the solution. So what I'm going to do is get this little drop of blood right here, and I'm literally going to just wipe it in to the well S. So you can see right there, well S. Hit that. what I'm going to do is now just wipe my finger, go ahead and place on the Band-Aid, easy as pie. I'm not even really bleeding much anymore.
Yeah.
Doesn't hurt at all, folks.
Here's the buffer I put for you guys, and there's this little aliquot.
Yeah, so I'm going to get my little pipette. I am going to squeeze out the buffer, and I am going to place 2 drops on this bottom well B.
I would just hold it up there. I would hold it. I would pretty much give it all.
Here, I am going to just go ahead and put that in. Yeah. There's a 2 big drops.
All right, and start the timer.
Timer starting.
10 minutes. Yep. So we're at 55. So at 05, we'll read the results.
Perfect.
See, and this is called a lateral flow test, and it's going to pull. Oh, you can already see it. Look at that. You see that? That's called capillary action. You see that? How it's already starting to go up. So it's going to change. I'll hold this right here. Is this exciting or are you guys bored? Is this exciting?
I think it's really cool.
You see the purple going up? That's called capillary action, bitches. I'm telling you. Do you remember that from science?
I do.
Okay. So it's going to turn that blue line to pink. And it has the G and the M. The G stands for IgG, which shows past infection. And the M stands for IgM, which is current or active infection. And these are checking for antibodies. So your body has to have the ability to make antibodies. Now, some people, like some elderly people or some people on like chemotherapy, they can't make antibodies, huh?
Cannot.
They cannot. So this would not be a great test module for those patients, but for the average person, this is great. Now in 10 minutes, which 9 minutes to go, we'll read the strips, okay? So what we're looking for is this. I had this card made, and you guys can see right there, okay? Here's your IgM. You're gonna have a line through the IgM or a line through IgG, which is past infection. You can have both, but we're looking for Erica to have just one control line. That's the negative line. So I made this card for dummies. You don't get this card unless you order through us.
Yeah.
Sorry, you want 10 minutes. All right, babe, you want to stick around or do you want to come back in 10 minutes?
I'll let you kill it. Come back in 10 minutes.
Let me kill it. We got to talk about hospitalizations. Oh, come back real quick.
Yes, sir.
Just so people know, have you had any sort of symptoms, coughing, fever? Not really?
No symptoms.
No symptoms. Do you go out much? What do we do?
We are really at home. We don't go out much at all. Grocery store, Dr. B cooks. I cook sometimes, and we really
birthday presents. I bought a lot of birthday presents.
Amazon orders, a lot of boxes coming in with COVID tests and gifts, and we're kind of just keeping home, laying low until we are safe and keeping everybody else safe. Hopefully
what about
vaccine around the corner?
Yeah, what about hanging out with friends or family?
Do not hang out with friends and family, and if they do, he wants to poke them all, which we totally have to do. He's like,
with the test, ladies. I don't poke them all.
Yes, so we do test them. My neighbor spent the Easter with us. We tested her for Easter. She's come over for birthdays, tested her then.
4th of July. Easter? 4th of July.
Yeah, Easter.
Yeah,
that's when it first
when it first. I didn't have the test back then.
We didn't have the test, so that was 4th of
July. Yeah, when I got back.
Mm-hmm. So we really keep it lay low.
We don't go out. We don't really do much. We don't hang out. And the people we do, we test. Erica, your mom's here.
My mom's here. My mom
since
tested
November,
when she
since
got
beginning
off
of November.
The plane. Yes. So.
Yeah. It's really a different strategy. You have to have a frequent testing strategy. So I'll call you back in 7 minutes.
I got the timer going.
Oh, okay.
We are 6 minutes, 57 seconds.
All right. Let's talk about hospitalizations, guys. Okay. So it's really quick and simple. We have to change our testing strategy. If you want to order these COVID rapid test kits from me, just go to facebook.com. And what I want you to is you have to message me a certain way. I am not responding to all these tire kickers, okay? Listen, real quick. If you're interested in the rapid test, they are normally $5 for $500. That's $100 each. One person didn't hear me right and told me to fuck off for wasting their time. So I'm like, dude, I can't help it that you don't understand. They're $5 for $500. That's retail, $100 each, $5 for $500. But I wholesale them to you for $50 each, minimum order of 20, $50 each, minimum order of 20. So what you want to do is to message me $24,000. That way I know you know the price. And then that's free shipping with 40 or more. So if you want free shipping, 40 more, you are going to need them. They give you 10-minute results, 95% accurate. You don't need a lab. You don't need to send it anywhere. You read it like a pregnancy test in 10 minutes, all right? And they're 95% accurate, and they're on the FDA EUA. All right, let's do this. And as always, I will edit down this video, get rid of the sales and stuff, and I'll put it on the YouTube channel. Hi, everybody. I'm Dr. Doug Fung, world-famous bariatric surgeon. I want to talk about why the hospitalization numbers are actually a lot worse than what people are reporting, okay? All right, so today is December 13th, Sunday, December 13th. This is important because numbers and facts and figures always change, okay? So this week, in case you missed it, late Friday night, the FDA approved the Pfizer vaccine in the United States, which means frontline healthcare workers will get vaccinated as early as tomorrow. All right, so as early as December 14th, there'll be about 125 or so facilities getting vaccinated. And then on Tuesday, about another 420 facilities. All right, and that's the front line. These are healthcare workers that are on active duty in the front line, and then residents of nursing homes. That's 1A. 1B will be first responders, paramedics, EMTs, police officers, firefighters, and then also essential workers. If you can't be off because you've been declared an essential worker, food processing, delivery, grocery stores, etc. The bad news is the vaccine will not be readily available to normal people, us normal people, until approximately April. So April Fools, bitches. So we will surpass, today is Sunday, December 13th. We have passed 16 million cases. We will probably either today, by tomorrow's reporting, we will surpass 300,000 American deaths. And I know I have international people watching, but quite honestly, USA is the shit show. So don't think I am dismissing the pandemic for other countries. It's just that we have just fucked this up so bad that the US is just really a laughing stock. All right, and so today's video is really about hospitalizations. And even though these vaccines are coming to the frontline workers, it's actually worse than you think. So number one, all right, so for all of the deniers, these people have such confused logic. They'll, in one hand, they'll say like, oh, these cases are inflated. These numbers aren't real. They're diagnosing other diseases. They're diagnosing flu. They're diagnosing car wrecks. Comment if you know someone like that, okay? Here's the fucked up logic, all right? So comment if you know someone who thinks that this is overblown because they're lying about the diagnoses, they're lying about the cases. It's not really that bad, okay? That's one hand. In the other side of their fucking mouths, in the other side of their mouth, they'll say something like this. They'll say, yeah, but how many people are they really testing, right? So what they're thinking in their head is if we tested more people, if we tested everybody, then it's not as bad as it seems. So that way, by that they mean the death rate's going to be lower, and so that this was a hoax, it's a farce, it's a control thing. We didn't really need to shut down. It wasn't as bad as it was because we're not testing everybody. So therefore, it just seems worse than it really is. Well, listen to me, Uncle Billy. You can't have it fucking both ways. Which way do you want it? Okay. And then on the third corner of their mouth, they're saying, oh, the numbers are only high because we test so much. What the fuck's wrong with you? Like, where's your logic there? Makes no sense. Do you want us to test everybody to show that the death rate's actually lower than reported? Or do you want to stop testing? That way our numbers doesn't seem so high, a la you know, our president, our current president, who's soon to be out of here in a month? Do you want to use that logic? Or do you want to say, oh, no, the cases are actually lower because doctors are a bunch of fakes and phonies and they're lying on the death certificates? This is how illogical people are. This is how confused and angry and frustrated they are. So what I want to do is, one of the things like I do these lives for is because I try to cut through the bullshit for you guys. So when Uncle Billy, when Aunt Sally, when they start talking like this, you can easily point out their delusion. Like you can easily say, listen, that makes no sense. Which way do you want it? Do you want the death rates too low? Do you want to say we test too much? We don't test enough? You want to say that, hey, these healthcare providers who are taking care of our cousin, who's taking care of our aunt, who's taking care of our grandmother, they're lying. We want them to do their best stuff. We want the doctors to treat our loved ones, but somehow we want to believe that they're dishonest. We want to believe that they're lying. You can't have it both ways, yo. In fact, that was one of the videos where I was like, dude, this is just fucking bullshit. To sit here, but from the president of the United States to say that doctors are lying about numbers so they can get higher reimbursement is a fucking joke. It's a farce. It's an insult. It's so insulting. But so for someone to sit there and repeat it just goes to show you like how screwed up they are in the heads, how they can't have common logic, right? How it just makes no sense. It's gotten so bad. It's gotten to the point where I actually quit going back and reading the comments because you can't even argue with these people. So if that's you, I don't need your comments. I don't need your likes. I don't need your shares. Get the fuck off my page. Just go away, crawl into your hole. I used to be like, I love you, stay safe. And now I'm to the point where I'm like, yeah, just fuck off. Because I can't convince you. You can't tell people. You can't change their mind. Oh, Dr. Vong, you keep saying you're political, but you point to like our president. Dude, if our president was a Democrat, it's not political. It doesn't matter. I'm not angry at the political party. I'm disappointed by the person. It's the person. It's not the politics, guys. And the fact that you think that I'm one way biased, one way or the other. Listen, you don't know me. You don't know my politics. You don't know how I voted. I didn't vote. You don't know if that's true or not. I could have lied. Look, I just lied. No, I didn't. So you don't fucking know. I'm sober. I'm drunk. You don't fucking know. Rather, you don't know. But you do know the fucking behavior, don't you? You know that Uncle Billy's confused. You know that people are saying different shit. They're very confused. They don't know what they're saying. Okay? So, I heard an alarm go off. People are unbelievably stupid. No, they are believably stupid. Janine, they are believably stupid. In fact, you're seeing it. Hey, 10 minutes is up. Come on, Erica. Let's see. We just tested Erica with our COVID rapid test. Do I get to keep sleeping in the same bed with you, or do I need to put you into the guest bedroom? Let's see. Drum roll. What do you mean? Look at that. Boom. Erica's negative. High five, baby. Give me a kiss.
This guy.
What? You're negative.
I'm negative.
She's negative. See? You just want one line. 10-minute results. Easy. Didn't hurt, did it, babe?
Didn't hurt. Not at all.
Convenient. Listen, this is what's needed. We need regular testing. You have to have your own protocol. I don't care if you get it from me or not, but I'm telling you, I'm the only one who puts these kits together, right? You're not getting, if you find it cheaper somewhere online, you're not getting what I'm showing you. It's not going to be sent to you the way I showed it to you. So message me if that's what you want on facebook.com/Dr. Vong, 24,000. So I know. All right, let's go to number 2. Why are these numbers higher? Okay. So hospitalizations are actually higher. All right. One of the things that's weird, right, that we're starting to see is you're starting to see reports about, hey, the medical system is pushed to its limits. We are at 80% capacity, 90% capacity. hospitalizations are actually higher than what's reported. No, Dr. Vong, we have meetings. I know, I sat in through all those meetings. No, we are at 95% capacity. We're at 90% capacity. There's this hospital in Las Vegas who's opened up a ward in the fucking parking garage. They're seeing patients in the parking garage. Never in my life would I have thought that this would have been the case where you'd have to actually practice medicine in a freaking parking garage, okay? Now, let me tell you, is that reported? If you see patients in a parking garage, do you report that? Is that because, we are under guidelines in hospitals. You are accredited. Hospitals are accredited for a certain number of beds. This hospital has 10 ICU beds, has 20 ICU beds, whatever the number is. Now, what happens if you open up a parking garage? What happens if you put up a white tent? What happens if you turn your convention center into a hospital? How does that figure into your hospitalization rate? Bet you never thought about that, did you? You, Billy? Oh, they're lying. These doctors are lying so they get more reimbursement. What fucking doctor wants to work in a parking garage? You tell me, Uncle Billy. Like, what the hell? They get paid more. They're going to make away like bandits. Really? You're on Social Security. You're on Medicare. You're not even paying for this shit. You don't have no clue. You don't have two nickels to rub together. And somehow you've become this financial guru who knows what reimbursement is for insurance, for hospitals, for all their billing, for their back pays, co-pays, non-deliverables, blah, blah, blah. Somehow now you have a degree in accounting and hospital work. Hospital administration. Here's your PhD in hospital administration because you seem to know doctors and hospitals are making away like bandits because we get to code a car wreck as a COVID case. What the fuck's wrong with you? You have no clue how much it costs to take care of a patient who's been in a car wreck, do you? Stupid. I get pissed, man. I get so pissed. All right, so first of all, what do you do about all these extra beds? All right? God, can I hear some amens? Can someone give me some love here about the stupidity, about what's going on, Right? Maybe, right? Fucking Billy. Come on. Give it up. Ignorant, not stupid. Come on. What is wrong with people? Can I have some amens? Amens. Thank you, CL. Nicole Hoover. Amen. Sick of it. CL. Lisa. Brian. Brother. God, it's so silly. Like their logic is not even there. They don't even know. They have no ideas. They think let me tell you something real quick. Let me tell you something. Uncle Billy still thinks $1 million is a lot of money. These doctors are making all these money by coding things COVID. Oh, yeah? How much? $1 million. Oh, my God, $1 million. You think that's the number in healthcare? You think that's a lot of money? That's a fucking rounding error. That's a rounding error. I told my boss one time, my nurse practitioner, my PA, my physician assistant left. And it took us over a year to find a replacement. And that whole time, I did her job plus my job. And at my 2-year review, I told my boss, I was like, I've saved the system some money. I've been doing the work of 2 people. I saw her patients, I see my patients, and I'm saving them her salary and their benefits, and it's $150,000. And he was like, while I appreciate your work ethic, Dr. Vong, he goes, it really isn't that much money. It's just a drop in the bucket. Now, I know some of y'all will get triggered by that. Some of y'all will think that's a shit ton of money. That's a great salary. That's a way, whatever. Dr. V, you should be pat on the back. Dr. V, you're delusional. Dr. V, whatever. It doesn't fucking matter. It doesn't matter your feelings. I'm telling you, it's just not that much money. It's just not that much. And it doesn't matter how much money's coming in, dickhead. It's how much money's going out. If they give me $1 million, but I have to spend $1,000,001 on a COVID case, you lose money. No one's making money on this, dickhead. Like, it's just so crazy, right? Oh, but they get paid 20% more. Who cares if we get paid 20% more if it costs us 21% more to care for that patient? If they're on the ventilator for 3 weeks, if they take up an ICU bed for 4 weeks, because that's not in our algorithm. We know the average, this case, this heart bypass should be in the ICU on average 4.5 days or 2.3 days or whatever your protocol is. This particular surgery has this number of ICU days. That means that ICU bed is occupied for 3 days, 4 days, 5 days, and then we know it will be available. Fucking COVID comes along. Now, we don't fucking know if they're going to be in the hospital, in the ICU, on the ventilator for 3, 4, 5 days, 6 days, whatever. We don't know. Oh, but you're making a killing. No, you're not. What is wrong with you? No, they are not. People, the numbers are high because doctors are lying about the number of cases. Dude, go crawl under a rock. Can't talk to you. All right, let me get to some other shit real quick. Okay. Hospitalizations are actually higher. Why? We have lowered. All right, this is the big point here. So screenshot this one. I have a typo. Okay. Here's the problem. Who remembers the springtime? Everybody was looking at Italy, then Paris, then Madrid, then England, and then our turn, New York City. Everybody was looking at New York City. These nurses were coming in from all over. They were, because New York was running out of nursing staff, and doctors were getting called out of retirement, right? And the world is watching New York City, and we saw all these ICU pictures and all this sort of stuff, okay? And these hospitals were getting bloated and full. We were admitting people because we didn't know what we were dealing with. We didn't know what was going to happen, right? Yeah, Dr. Vong, that's the problem. It was a hoax. We totally made it a big deal. See, my cousin, he had it. He got over it. He didn't die. And I know 5 people who got it who didn't die. Listen, motherfucker, we didn't know what we were dealing with. So we were admitting patients. And we watched them. And then we started hearing reports. Dude, they tank fast, right? Here's the stuff that Uncle Billy doesn't know. In the springtime, while this was happening, doctors, because we were fucking shut down. So we had no other ways to really communicate. So what were we doing? We took to social media. There are lots of Facebook groups for COVID physicians, treatments, the latest. So, right. So we're in these groups trying to figure it out. Well, the first thing we realized was like the people in Washington state where it first started, then moved over to New York, et cetera. They were saying, hey, listen, guys, this is bad. This is worse than you think. I know the Washington was the hot spot, right? But listen, it's worse than you think. These patients are tanking. They're going fast. They're on the floor. They look good. You round on them in the morning. You think they're going to be fine. And that afternoon, they're being intubated. Guys, we are in our Facebook chat groups talking about this stuff back in April. And we're like, dude, you can't take your eyes off them. They're going fast. And hey, we're doing PEEP. We're doing all the stuff. And then a month later, we go, no, you can't use PEEP. PEEP is bad. PEEP, it blows out their alveoli. It blows out their lungs. And then suddenly you start seeing these conspiracy theories. Like, we're trying our hardest to figure this shit out, right? And these fucking stupid ass people doing these conspiracy theories are like, doctors are killing patients. They're ventilating. They're blowing out their lungs. They're causing this. And then you have these stupid videos about they're treating. It's actually like It's altitude. Who remembers the fucking altitude sickness? The doctor who's like, I've treated these patients and this is like altitude sickness. It's not pneumonia. It's not ARDS. It's this. And then all these people suddenly got their Google MD. Who remembers all this stuff, man? And then it starts coming out like, oh shit, there are blood clots. There's microemboli. And all these fucking people had opinions. The day before, they never even knew the word emboli, and now they're suddenly experts on microemboli. They don't even know what micro means, much less emboli, but somehow I'm getting all these messages about these microemboli, right? And then these doctors are getting paid more, and this, and it's overblown. And now look at this. Okay, so here's the problem. Fast forward, December. Today is December 12th, 2020. The numbers should be worse. If we kept the same admission criteria that we had in the spring, the hospitals would be overwhelmed. You guys understand that, right? If we continue to admit people today like we were doing back in May, we would be out of hospital beds all over the United States, okay? We are sending people home. Comment right now if you know someone who was having trouble breathing, they're COVID positive, and they got sent home, okay? So number 3, and it's not right or wrong. It's just, we just have to manage the systems, okay? All right. Okay, here's the thing. Patients are being sent home. I'm not saying that's wrong. I'm saying that's the state. Back in April, they would have been admitted because we didn't know what we were dealing with. Now we know if they look a certain way, if they're younger, if they're healthier, if they have 2 brain cells, if they have connectivity, right? If they have Wi-Fi, we can send patients home. We can monitor them remotely. We can get on a Zoom call. We can send them home with home oxygen. We can monitor them. How far do you live? Oh, you live a mile away, right? Come back here. And we stress this now. We say, don't go to another hospital. Come back to the same hospital. It's called continuity of care, fucking Uncle Billy. Quit fucking hopping from I didn't like how they treated me at that hospital, so I'm going to go to this other hospital. Don't fucking do that. Your records are at this first hospital. They know you were there 3 days ago. They know that your numbers are worse. They need to admit you. They've already tried sending you home. Listen, these doctors are overwhelmed. These nurses are overwhelmed. They're going to drop the ball. It's not a fault. It's not wrong. It's not malpractice. It's just the state of where we are, okay? So by criteria from the spring, these hospitalizations should be higher. We are at 109,000 people hospitalized. We should be double that. We should have way more hospitalizations. Does this make sense? Does this make sense? Okay, so in the spring, you had a hospitalization number. Follow me. December, winter, we need now, we don't have it, but we need a hospitalization number plus a at-home number. How many COVID positive people went to the hospital, got tested to be positive, but they are being cared for at home? Not sent home, not abandoned, not turned away. We are extending our healthcare reach. We are treating you at home. How many patients are being treated at home with remote monitoring, with home oxygen, with, hey, nurses calling you? Who's the responsible adult? The wife, the spouse, the daughter? There are 13-year-old kids, 14-year-old kids who are the only responsible person at home that has to sit by the phone, and when the nurse calls that morning, here's your window, 9 to 10 a.m., 10 to 11 a.m., There are 13 and 14-year-old kids who have to take that phone call because they're the only ones at home and give the report to the nurse or the nurse practitioner or the doctor. It says, how's grandfather? How's your mom? How's your dad? How are you breathing? Breathing okay? What's the number on the little thing on their their pulse oximeter? What's the number reading on their finger? Oh, it's at 91. It's at 92. Good. How much oxygen? What's the number on the little oxygen machine with the turn knob? It's at 2. It's at 2. Okay, it's at 2. Now listen, young little Mary. You need to turn that number up to 2.5. How scary. How scary for a 13-year-old daughter to have to do this. And we still have people who thinks this is a hoax. We still have people criticizing their governors and mayors for shutting down restaurants. What is wrong with you? I know this is hard. It's time to adult up. I know our leadership hasn't been perfect. I know that they are about 3 months behind passing a stimulus bill. I know this is all needed. I know this money shouldn't have gone to big chains and restaurants and big businesses and should have gone to small business owners, mom and pop stores. But being angry about it's not going to fix it. You not wearing a mask is not going to fix it. You denying it is not going to fix it. You need to cancel your Christmas celebration. You should not be gathering. You should not be traveling. You should not be getting on an airplane. These numbers are worse than being reported. Comment if this is the first time you've heard anybody explain it like this. There is a hospitalization numbers, roughly 109,000 people in the United States in hospitals right now. But we also need another number. How many patients are being watched at home that are not being reported? Oh, there's only 16 million cases. Someone yesterday, I did my COVID yesterday, said LA has 10,000 cases. Today, LA has 10,400 cases. And this dickhead says, there's 10 million people in LA County. What's 10,000? And I went, dude, that's 10,000 in a day. It's not 10,000 total, dickhead. It's 10,000 in one day. It's just a matter of time before we cannot sustain this. So we need a whole new number for patients being treated at home. Okay? We don't know these numbers. Hospitalization numbers are worse. We don't know this number. We don't record this. Here we go. Here we go. Screenshot this. We don't know the psychological, traumatic impact that this is having. Open up schools. We need to go back to schools. Why? My kid is hyperactive. That's your fucking problem. That's your fault. Quit giving them sugary candy. There are things to do. We have to get past this. It's one semester. I've been saying this since the summer. It's one fucking semester of college. Why did they open up college this fall? Stupid. Greed. Now we have these huge vectors coming home for the holidays called freshmen and sophomores in college. It's awful. Sports, football, really? The Super Bowl? You're going to have the Super Bowl in Florida? Really? During the peak, mid-January is the height. It's going to be the peak of the pandemic. Why? Why are we having the Super Bowl? You can't sit there and complain about the psychological impact of this. Dr. Vong, depression, anxiety. Like, listen, people like to use these little catchphrases, right? The cure can't be worse than the disease. Really? People are committing suicide, drug abuse, drug overdoses, abuse at home. Really? You don't think I've known that? Of course. But you get past that by getting over this. How many more people could we have helped if we had just stayed locked down like Europe? If we had just worn our masks like Europe? If we had a normal second wave like Europe and like gone over it, surpassed it? If we had followed Australia and shut down our borders, shut down the borders between states, fined people, Australia's gone back to normal life. Yes, they still have to wear masks. But look at Australia. They're in the southern hemisphere. They have warm weather. Canada did the same thing. Their downside is they had winter. So people are congregating. So they're going to have a small increase. But they have 6,000 cases. They don't have 260,000 cases. It's crazy. Oh, but it's a population thing. Oh my God, you're not going to outsmart me on this. It's per population, dickhead. That's already factored in. Stop it. Be a grown-up. These numbers are worse, all right? Despite what you think. A last thing. And then I'm going to eat lunch. Listen. Believe me. The community numbers are far worse than reported. We are just starting the Thanksgiving surge. This is the start. We are going to fly through 300,000 cases a day, every fucking day. Just like right now, like we used to panic about maybe hitting 100,000 cases. And now if we had a day where we had 100,000 cases, we would be like, woohoo, see, it's working. Look at that. American ingenuity. Told you it was a hoax. Whereas before we were paranoid about getting to 100,000. We are going to fly through 300,000 cases just like we flew through 200,000 cases. If tomorrow suddenly we had 200,000 cases, we would think like, oh my God, it's so amazing. We're so awesome. See, it's a hoax. What is wrong with people? These numbers are far worse. Listen, Arizona dickheads, your positivity rate's 25%. 1 in 4 Arizonans who test have COVID. Who test? See, Dr. Vong, they're not testing enough. See, Dr. Vong, they're testing too much. Which way do you want it, you confused motherfucker? Which way do you want it? The numbers are the fucking numbers. It's worse than you think. Multiply it times 10. Multiply it times 10. That is really what we are dealing with, guys. These hospital numbers are worse than they look, and they are going to get much worse. Okay. I love you. I was going to test myself, but I'll save it for tomorrow. I can't do this. I'm going to go eat. It's dark times. Winter has this weird effect on people. Daylight, lack of sunshine. It's a gloomy day today. It's been raining all day here in Houston. You get into these moods. You don't want to deal with it. You read comments. You look at people, things people say, and you sit there and go, here's the problem. You go, oh, these are Russian bots. This is not even a real person. They don't have a profile pic. It's a bot. A lot of them are bots. A lot of them are fake accounts. But a lot of them are not. A lot of them are not fake accounts. And I think that's what's really horrifying. A lot of them on YouTube are actually really people who really, really believe that this is all a hoax. And you know what's fucked up? It doesn't matter if they think it's a hoax. You're going to have to wear a mask. You can think this is a hoax. Wear your mask. You can think that this is, a travesty against your rights. Fine. wear a mask, stay at home. You think that like your next door neighbors, your best friend's business is being shut down, they're going to lose their livelihood, or it could be you. Fine, wear a mask, file for bankruptcy. Like we all are gonna, like there's going to be, if you're a lawyer right now, if you're in law school right now, this would be a great time to focus on bankruptcy law, because you're going to be really fucking busy the next 2 to 3 years. It's just a fact of life. It doesn't matter what you think. It doesn't matter how you vote. It doesn't matter what you believe. It doesn't matter. It is for real. It's here. It's worse than you're being told, because nobody in real media, on television, on radio is going to come on and tell you to fucking mask up. No one's going to come on and call you a fucker like I do. It's just what it is, man. I don't like it. I don't want it. But do what's right. Do what's right. And listen, as always, for our first responders, our healthcare workers, prayers and wishes to our doctors, our nurses, our assistants, our phlebotomists, our RTechs, our labbies, our orderlies, our hospital crews, housekeeping, prayers and wishes to them. Let's just do our part, guys. Let's get beyond politics. Because right now, if you are posting that this is a hoax, if you are posting that the numbers are a lie, you just look like a dickhead. Why? Because somebody has lost a loved one. And you are just a penis, man. I'm just telling you. I was going to test myself, but I'll do it tomorrow. I'm too depressed. Love you guys. Be safe. Be kind. Take care of each other. Bye.